So first, I want to thank the organizers and the European Lung Foundation for creating this panel discussion and for inviting me. So my name is Brice van Eeckhout. I'm the CEO of Communicaire, which is a startup working on patient support solutions for patients with chronic diseases. But I'm also here as a member, as a partner of the Dragon project, which you might already have seen in some slides this morning, as the project is actually focused on increasing global response capacity to the COVID-19 crisis, but also to future pandemics. So in the Dragon project, we are mostly involved in a subsection of it, which is about patient empowerment through decision support systems. And we're doing this in partnership with ELF, ERS, and BioSci Consulting. The main goals of the project, the subsection, are fourfold. So the first one is really to try to bring the perspective of patients inside of the project and its developments. And this has been done through the creation of a citizen and patient advisory group, but also by participating and getting patients involved in conferences such as this one. The second big pillar is about creating a wider stakeholder community. So there we are trying to gather the perspective also of clinicians, researchers, medtech developers, but also decision makers, for example. The third pillar, which is most the subject of today, is really about the development of multiple apps for the support of patients and citizens throughout the COVID-19 crisis. And the last one, of course, is the integration of what has been created inside of the Dragon project, which is mainly about decision support systems, so predictive models inside of the tools that we are developing so that it can also really benefit to patients in the end. So Dragon wasn't designed to work on long COVID, as the project was actually written in the early 2020. But we had to evolve and adapt since we want to develop solutions where we can add the most value, of course. And we can see that there is a shift of focus towards also long COVID, as this appeared to be a very relevant subject. It's touching a large fraction of the population. And we had insights on this, for example, through different testimonies of patients, such as the one of Ellen Parks, which was gathered by the European Lung Foundation. Of course, this is extremely relevant. However, it's still very difficult to develop solutions. First, because we have a large panel of symptoms, as we've seen also in the last talk, and because we are still at the early days of research done on long COVID. As the Dragon project is a European project, we wanted, in parallel of the development of our tools, to work on research which is built upon the insights that we already have, all the research that has already been done, and trying to do this on a pan-European level. And here in the research that we want to do, which is a study called CoVinci, we really want to focus on the evolution of symptoms of patients after COVID-19. The CoVinci study is a year-long study that includes patients which have had a positive test of COVID-19 in the last 6 months, that are majority of age and are able to use a smartphone. And basically what we ask participants to do is to regularly just answer questionnaires during a 1-year period. For this research, we've built a specific digital tool, as the whole research is done remotely, and I wanted to quickly present it to you. So here the participant goes to the platform, and before actually being a participant, it's about decision making. So do I want to be part of the research? So the first parts are about eligibility. So we check whether you're eligible for the trial. And we also present some information modules about the research. Then we have a short quiz, which makes sure that you understood the information correctly. And then we try to gather preferences to make sure that there is a match between the trial and the patient, that the patient is actually interested to participate. The second part of the app is more about the participation. So first, you're able to register very easily by signing an electronic informed consent. And then we can start working on the questionnaires themselves, which are in different format. And most of them are questionnaires which are completely validated and are already used in research, but really targeting long COVID symptoms. So where are we today? We are getting now the final ethics committee approval. And we still need to translate the tool in different languages, but we're really close to launching the study. And then the next step will be publishing results, of course, but also to use what we've gathered to develop a support solutions. So if you're already interested, if you have had COVID in the last 6 months, a positive test, and you're interested to participate, don't hesitate to already go to the link here or to scan the QR code. It doesn't commit you to anything. It just means that if you provide us your email address, we'll just send you the information as soon as the study is starting, so that you can decide whether or not you want to participate. So what is the point of this? Of course, the research part is also about making a tool to support patients. Before even working on long COVID, we are already finalizing a first prototype of a tool to support patients that are positive to COVID, but that can be monitored from home. I think the tool is interesting also in what we have discussed today about the need to get informed and to find the right information. So ELF has done tremendous work by consolidating a lot of questions that were asked by patients about COVID and long COVID, and to get them answered by clinicians. And this is the type of information that we will gather inside of the information part. Then, of course, we try to monitor patients through symptoms and parameters. This can be done manually, but we also have some devices which enable to automatically input the data inside of the app. And so you get a better communication with the clinicians from the hospital, which are able to actually monitor you and create video conferences. So it's all about getting a better communication and an efficient communication in a system, a healthcare system, which is currently under pressure. So this concludes my presentation. If you're interested again in this research project, don't hesitate here again to scan the QR code or go to the link. And of course, I'll be part of the Q&A. If you have any question, don't hesitate to do so. Thank you very much.